Good afternoon, everyone. This is Desiree Tucker-Serini. Barbara, were you able to get on? I don't think so. Unfortunately, Barbara Reynolds was not able to get her audio working. So I am going to do the opening. Welcome everyone to our November 18th, 2020 sponsor call. We are going to have a really fun agenda today. I'm very excited about it. We have a guest speaker. I'll do the welcome and introductions and give a few updates. And then we are having a guest speaker, Dr. Pamela Paxton, and then a Q&A and a webinar evaluation, some information on that, and some closing remarks. I wanted to make sure everybody knew the different ways that you can access. Before we dive into the rest of the program, I wanted to mention a few features in Zoom to make sure you get the best of the presentation. On audio, you can join by computer or phone. There are new dial-in numbers and passcodes, as you can see on this slide. Chat is monitored throughout. Test now with a short greeting. Hey, hi, hello, whatever. I'm seeing so many wonderful greetings coming in from all across the country. And recording and slides from today will be posted to the VISTA campus in the next few days. I wanted to say happy November, everyone. I hope that you and your families are safe and healthy. I also wanted to talk to you all. I was going to start off with kind of a silly quote, but I love Lily Tomlin, and she said, "The road to success is always under construction." And I would say in 2020, not only has the road been under construction, but there have been so many detours. Just to go a little beyond that and talk a little bit about how we've had such uncertain times this year, we know that the increased spread of COVID-19 is really exacerbating the strain on all of us, on our healthcare system and our economy. And I think this is a great time, particularly as we approach Thanksgiving, to give each other some grace and gratitude. I know it's a very difficult time for nonprofits, local governments, and higher education. And yet this is also the time when national service is most needed. Please let us know how we can best partner with you and help you and provide support. Our goal is to provide you with transparency and accurate information. So I wanted to talk to you a little bit about the budget overall. I'm hopeful that Congress will pass a budget prior to December 11th deadline, when the current continuing resolution ends. It wouldn't surprise me if we got another continuing resolution, and we wanted you to know that talks continue on an additional COVID-19 stimulus package. I wanted to, for this update, to give you just a quick summary of the VISTA budget and how that is going this year. We've had some changes that are affecting our recruitment levels. You may have had conversations with your AmeriCorps regional teams about what resources are available to support placement of VISTAs in this fiscal year. And we wanted to update you about that, the current state of the VISTA budget nationally and the resources available to support VISTA members across this country. AmeriCorps is operating under a continuing resolution, a CR for short, until December 11th, which is about 73 days of funding based on our FY20 appropriations and budget allocations. Between now and December 11th, Congress will continue to work to reach an agreement for funding for the rest of the fiscal year, or pass another short-term CR or continuing resolution. AmeriCorps, as well as other agencies, must plan accordingly for the challenges posed by flat funding levels provided by a CR. So we literally are only funded until December 11th. Whereas if we're under normal budget times where you're funded for the full year, it does not force you to so tightly budget. This means that AmeriCorps VISTA program is operating on a flat budget based on last year's appropriation levels. And for a variety of reasons, that also means we're not able to support as many VISTA resources as we did last year. And there are several reasons beyond the continuing resolution for that. In our statute for VISTA, we are required to review and evaluate the VISTA living allowance every year to better support our members, and we also look at it to figure out if we need to increase it based on a formula. And for this is for 1 year. When you take it as a 3-year average, it's 2.8% increase, and our 10-year average increase is about 2.6% increase per year. A second reason that has impacted our VISTA resources is that our VISTA cost share program is how some VISTA sponsors contribute to some of the costs for the support of VISTA members. The cost share program allows AmeriCorps to increase the number of VISTAs and VISTA members placed in a year. Importantly, the cost share program depends on the ability of the sponsor organizations to have the local resources to participate. Unfortunately, the pandemic and the accompanying economic challenges are affecting resources of nonprofit organizations, educational institutions, and state and local governments. As a result, we are seeing a decrease in sponsors that are continuing their cost share programs at the same level as in previous year. This decline in cost share participation does decrease the number of members that can serve. A third issue is as we recognize the challenging time nonprofits were having, VISTA decided to increase the funding for support grants. This is to strengthen and build capacity for our nonprofits all across the country. But that also took away for us to fund some additional members over the year. Also, over the past several years, there's been a significant increase in the number of VISTAs choosing the end-of-year stipend instead of the education award. The end-of-year stipend is funded out of the VISTA budget, impacting available funds for members. The education award, which is still what most of our members do pick, is funded out of the AmeriCorps Trust Fund, not the VISTA budget. So that also has an impact. And then, of course, as I previously stated, we're operating under a continuing resolution. Our regional offices are working hard to place VISTA members with you, but they are currently operating with less resources in their regions for placements than last year. I want to reiterate that the federal budget process is very dynamic. So our budget could change, and it could change quickly. Congress and the President continue to work on an FY21 budget, and discussions continue about a supplemental that would address the funding needs that have arisen due to the pandemic. We will continue to monitor this situation, and we will give you additional information as soon as we are aware of it. I hope this update on the VISTA budget was useful to you and helpful in understanding the constraints under this particular fiscal year. I'm so excited about our guest speaker. And I've asked our Director of Program Impact and Operations to introduce her. Rob Cox, take it away.
Well, thank you, Desiree, and hello, everyone. I'll just start by saying that AmeriCorps strongly believes in producing credible and meaningful research on national service, social innovation, volunteering, and civic engagement. And the AmeriCorps Office of Research and Evaluation, which is led by Dr. Mary Hyde and her fantastic team, including Dr. Andrea Robles. I think a couple of them are on today's call. They spearhead those efforts for the agency. The Office of Research and Evaluation conducts original and sponsored research. They support evaluations of individual grantees, and they promote evidence-based service models. In recent years, the Office of Research and Evaluation has provided research grants to institutions of higher education to build out scholarly research on civic health. And one of the wonderful benefits of these research grants is that it allows us to engage the broader community of academic researchers, and I am thrilled to introduce you to one of those academic researchers today, our guest speaker, Dr. Pamela Paxton. Dr. Paxton is a recipient of both the 2015 and 2017 AmeriCorps National Service and Civic Engagement Research Grant. Dr. Paxton is the Linda K. George and John Wilson Professor of Sociology at the University of Texas at Austin. She received her undergraduate degree from the University of Michigan and her PhD in sociology from the University of North Carolina at Chapel Hill. Dr. Paxton has consulted for the U.S. Agency for International Development and the National Academies. She's the author of articles and books on social capital, women in politics, and quantitative methodology. Her research has appeared in a variety of journals, including American Sociological Review, American Journal of Sociology, Social Forces, Comparative Politics, just to name a few. She's also published several books, one with Melanie Hayes, a 2016 book called Women, Politics, and Power, A Global Perspective, and a separate book called Non-Recursive Models, Endogeneity, Reciprocal Relationships, and Feedback Loops. And you can bet that I practiced saying that more than once. Today, we are thrilled to have Dr. Paxton taking some of her time to talk about the research she and her team have done on the impact of national service. Dr. Paxton has produced several studies with the research grant that she received from AmeriCorps, and today she'll focus on two that include VISTA. The first study looks at the impact of national service programs, including VISTA, on community well-being. And the second study, which is currently under peer review, so you're getting a preview of findings here, focuses on the influence of VISTA on sponsor organizations' ability to mobilize local resources, something that we talk a lot about here with the VISTA program design. In my humble opinion, I think these research designs that Dr. Paxton and her team have developed and that are reflected in these studies are incredibly exciting, they're incredibly elegant, and I think the findings are really important as we continue to explore the impact of national service. And I just want to say this is a journey. This gathering research and evidence is a journey, and we're really excited about this particular step in the journey. So without further ado, Dr. Paxton, if you're ready, we'll turn the proceedings to you.
Marvelous. Well, thank you so much for that nice introduction. And I'm delighted to be here to talk to you about some of the research that we've been doing that includes research on VISTA. And again, I do want to acknowledge right from the beginning that these two studies were funded by the Office of Research and Evaluation at AmeriCorps, along with a number of other studies that are considering basic scientific research on things like volunteering. Okay, I don't think I have the ability to control the slide, so I'll just say next slide if that's all right. Great. Okay, so I want to begin by trying to put these studies in context. So the real issue here is, what do we know and what don't we know about national service programs? And when we started the research, we already knew, I mean, not us, but I mean, in general, researchers knew a couple of things. We knew that AmeriCorps VISTA, AmeriCorps and AmeriCorps VISTA members help provide services, right? So you, for example, have members serving children through reading camps or food programs, rehabilitating, working with public housing, etc. We also knew there was some prior research that showed that AmeriCorps and VISTA members helped themselves over their own life course as a result of their service. So we know, for example, that participating in AmeriCorps VISTA will lead to increased levels of civic engagement later in life, more voting, more volunteering, right? But what we wondered at the beginning of this was, do national service programs also affect the community? Like, can we show that locating a national service program, like having an AmeriCorps VISTA program in a community, does that actually improve the community in terms of its well-being? Next slide. So we decided we would ask that question, right? And so in order to ask the question, do national service programs produce benefits, okay, for communities, community well-being, we had to do a couple of things. So first we had to decide, what is a community, right? How are we going to consider a community? And for this research, we thought about community as the county. And I'm happy to talk about that in terms of the questions later, if you have any questions about why that was maybe, you know, a good choice. We also needed to measure national service. And for this, we looked at the presence of AmeriCorps programming. And as it shows here on the slide, we considered both overall AmeriCorps programming, but also AmeriCorps State and National and VISTA and some others. The next slide, please. So another thing we needed to do then, so we know we're going to be looking at communities, we're going to look at counties for that. We know we need to consider national service programs, we look to AmeriCorps for that. How are we going to define community well-being, right? If that's what we're interested in understanding. So we went with this idea of subjective well-being. So you may have already heard people talk about the idea of gross domestic happiness, right? So some people say we need measures at the national level even that aren't just economic, like gross domestic product. We need to understand people's general well-being. So we need measures like gross domestic happiness. And typically people would measure something like subjective well-being via surveys. They would ask people, are you happy, right? And then they would take a whole bunch of people's answers, aggregate them and say, all right, this tells us something about the happiness of the community. So we did something a little different, if you can go to the next slide. So this is where it gets a little bit fun. We decided to measure subjective well-being using Twitter, right? So if you think about Twitter, a bunch of people are tweeting all kinds of different words. And these words can actually signify subjective well-being in one way or another. So I'm only going to talk today about engagement and disengagement, but this slide is showing you that there's other dimensions of subjective well-being that we looked at as well. So using words from Twitter that people were tweeting in different communities, we were measuring their engagement and their disengagement, as well as their positive relations and negative relations, and positive emotions and negative emotions. And we can think about this at the community level by looking at, say, disengagement. How many disengagement words are being tweeted by people over the total number of words being tweeted, which, as you might imagine, is a lot. Next slide. So to give you a sense of what this is like, right, when we're trying to measure this, again, I'm just going to talk about engagement and disengagement. So if we're trying to measure engagement, what this is showing you is these are some of the top words that come out of Twitter that are indicating engagement. And so they make sense, right? Interesting, alive, learn, awake, right? These indicate engagement with your surroundings, right? And we've included a couple of example tweets here as well. So I'll read the second one, right? A weekend full of flying, crashing, chatting, blah, blah, blah. I felt so alive, right? So that's a very, engaged tweet, if you will. On the flip side, you could think about words that would come out in Twitter that would signify disengagement. So things like bored or tired or lazy, or one reason I love talking about this project is I get to say meh. We used meh, right, as an indicator of disengagement. And so again, I'll read the second example tweet here. I'm so bored, literally nothing to do in this town. So this hopefully gives you a sense of how you can use Twitter to get at subjective well-being. Let's go to the next slide. So what are we trying to do then, right? This is still this research design. How can we connect this? So this picture here in the blue is showing you that what we're trying to do is we're taking AmeriCorps, presence of AmeriCorps in a community, and we're saying that it influences, and that's what that arrow is, subjective well-being, right? So that's basically what we're trying to do in this research project. And if we do something this simple, if we just do what's called a linear regression and we look at all these different counties and we look at this relationship, we do see that there's a relationship between AmeriCorps and subjective well-being, that the presence of AmeriCorps seems like it influences subjective well-being. Next slide. But what we have to do at this point is say, what could be wrong with doing something that simple? And there's two problems that we need to address in this research. The first is that we're looking across a lot of counties, and counties can differ in a lot of different ways, right? They could differ by average income, they could differ by education, they could have different racial or ethnic diversity. And so one problem might be that counties with AmeriCorps programs may just be different than those that did not receive those programs. So that's something important that we have to think about. The other problem is we're saying that AmeriCorps influences subjective well-being. But what if it's the opposite? What if counties that have a high level of subjective well-being, imagine counties that have a lot of engagement. Well, are they better able to get AmeriCorps programs, right? Are they able to better attract AmeriCorps programs? So it could be that what is actually going on is it's the opposite of what we thought. And so we need to address that as well. Next slide. So how do we do this? Well, there's two ways we do it. First, we do something called statistical control, where we take a whole bunch of these other characteristics about counties and we make sure we're accounting for that. So I'm listing a bunch of the ones that we considered here, right? So education, like I said, income, et cetera. So that's one way that we can better answer this question. And now I'm going to show you this somewhat complicated picture, but this is how we can address this possibility that it's the opposite, that it's the reverse, right? So what we did was we can have two waves of data. So that's what this second little figure is showing. So the little ones underneath AmeriCorps or subjective well-being are saying that that's in wave one. We're looking at this in 2006 to 2009. But then we also look at it in 2010 to 2013, and that's where it's got the little twos under it, okay, in the blue. And so what the arrows are showing us now is that we think that yes, presence of AmeriCorps affects subjective well-being in a county. But look, there's another arrow that says, well, maybe subjective well-being is affecting AmeriCorps. So if we use this model, then we are able to consider these reverse effects and make sure that the effect we find of AmeriCorps on subjective well-being, community subjective well-being, is real and it's not the opposite. Okay, next slide. So this is what we see. And again, this is just engagement and disengagement, but it basically gives you a sense. So what we see, let's start with those negative, those red negatives. What that is telling us is that both for overall AmeriCorps programs and for all the different subtypes of AmeriCorps programs, the presence of AmeriCorps in a county reduces disengagement, okay? It lowers disengagement. So we view this as buffering, right? That the presence of AmeriCorps in communities can buffer against this kind of disengagement. Now, if you look at the green pluses, then we see that yes, overall programs do increase engagement. And then probably quite interesting for you, we see that the presence of AmeriCorps VISTA in a county is increasing engagement. Next slide. So the quick takeaways here from this study then is that we do see that AmeriCorps programs can help improve community subjective well-being. We do see this, right? And this is taking account of all these reverse effects and all this stuff. We find that this is largely through buffering against negative aspects of subjective well-being, although we also see that VISTA has this positive effect on engagement. And then finally, I just want to point out that we did find some reverse effects. I'm not really talking about them here, but we did find some reverse effects. And what that suggests is that when you're considering applications, AmeriCorps may want to pay a little bit more attention to kind of quiet or atypical communities, right, that may have those lower levels of engagement or a little bit higher disengagement, meaning that they're maybe not applying at the same rates or something. Next slide. Okay, so this is a whirlwind tour of 2 studies. So I want to turn now to the next study, which, as already mentioned, is under review currently. And so that's exciting. This is like hot off the presses research that you get to hear about. Next slide. So let's remind ourselves of what we know and we don't know, right? So I already talked about the fact that from prior research, we knew that AmeriCorps and VISTA members help provide services. We know that they help themselves over their life course. And in the study that I just talked about, we showed that national service programs also affect community subjective well-being. So the question that we wanted to ask in this study was to say, do national service programs also affect the nonprofits themselves? So take VISTA. Does VISTA help nonprofits get more donations and volunteers? And we would certainly expect this, and it's a good question because one of the points of VISTA is capacity building, right? And so we would hope that VISTA is in fact helping nonprofits themselves get more donations and volunteers over time. So next slide, thank you. So there's a different research design here, so I want to talk about it a little bit. So the first thing here is to realize that we were able to make use of Internal Revenue Service data from Form 990s. So you may be familiar with Form 990s as nonprofit reporting forms. And so we have, through data collection, we have information from Form 990s that give us donations and volunteers from about 100,000 nonprofits from 2010 to the present. We worked with AmeriCorps to get VISTA data from 2003 to 2019. They kindly provided us with information on service terms at a number of nonprofits over that time period. So we're trying to do the same basic thing here, right? So again, this picture is going to look really similar to what you saw before. We are interested in knowing if receipt of a VISTA member or several VISTA members or participation in the program, right, influences that arrow, a nonprofit's levels of volunteering and levels of donations. All right, so next slide. We ask therefore the questions in two different ways. What we want to know first is, do you see that getting a VISTA presence in a nonprofit, is that related to greater volunteering and donations 2 years later, right? So we want to know, like, hey, you know, capacity building, you got a VISTA, and do we see that later on there's greater volunteering and donations? And then, so I know these questions seem very similar, but they're actually slightly different just in terms of how you go about answering them. We also then were asking generally, do nonprofits that have VISTA service members have higher levels of volunteering and donations in general over time? We're going to really focus here today mainly on helping you understand answering the first question, although we did ask both. Next slide. So like I said before, we got the data, and I'm sorry, I didn't change it to AmeriCorps. We got the data from on AmeriCorps VISTA placements. And we have both an indicator of just whether or not an organization received VISTA service members. And we also have a continuous measure, or a measure that's about the days, right? So we know actually how long the VISTA members were there. We know how many there were, right? So how many days of service did a nonprofit have? So we're actually looking at both of them. So let's go to the next slide. I'm going to do the same thing here, which is to say, what could go wrong if we were just looking at a very simple model of VISTA onto volunteering and donations? So the first thing that could go wrong is that, well, what if you're already a financially successful nonprofit? You already have a lot of donations, you've got a great fundraising arm, right? And you maybe go after a lot of different sources of funding. Are you more likely to apply for VISTA maybe? Maybe, right? So that's a problem. On the flip side, we might also say that what about nonprofits that already have a lot of volunteers? They might need to apply for VISTA to help manage their existing big volunteer programs. So either one of these would cause us problems in showing that it's VISTA members that are helping produce increases in volunteering and donations a couple years later, right? So how do we solve this problem? Next slide. We do this by matching. And so what are we doing with matching? So far, all we know is nonprofits that got VISTA, right? But they could be different than other nonprofits. They might have larger donation programs. They might have more volunteers already, right? There's a lot of ways in which they could be different. So what we do is we use a statistical technique that is going to help us essentially get a group of organizations that are really similar to, if not identical on various characteristics, to nonprofits that got VISTA, but they themselves did not get VISTA, right? So we're matching organizations, I'll say this a different way, we are matching organizations that received VISTA between 2010 and 2014, right? And we're gonna match them to organizations that did not receive VISTA, but that are very, very similar on every characteristic we could think of that would make them similar, right? Then we're gonna look at donations of volunteers. The second part of this methods is, this is the part that's answering it in a different way. I think it's harder to understand. I'm not really gonna talk about it except to say this is like a way of longitudinally looking at things over time. But I think the matching is like pretty intuitive to understand what we're doing there. Okay, next slide. So here, I took a couple of tables out of the paper, and I highlighted in that blue box what I really want you to pay attention to. So essentially, we have models that are predicting volunteers, and we have models that are predicting donations. So what we find is that largely the effects that remain after we do several things have to do with volunteers. So we see that both the presence of VISTA and the number of days of VISTA that a nonprofit receives produces higher levels of volunteers than nonprofits that don't have VISTA. And this is also true, and this is in the part, it's in the right-hand part of the slide under the 3 there. That model is saying, well, hey, wait a second, don't we need to also think about the number of volunteers they used to have, right? So shouldn't we think about whether placing VISTA in a nonprofit increases their volunteers from where they started, right? So that third model is including volunteers at the earlier point. And we see that VISTA is still having that effect, right, on volunteers. So I'm highlighting that in great detail because we don't find exactly the same thing for donations, which is the bottom part. For donations, we find that the presence of VISTA and the days of VISTA does have nonprofits there do have more donations than nonprofits that did not receive a VISTA, those matched nonprofits. But if we include donations at the prior time, we don't see an effect anymore. So that's suggesting that the VISTA member presence is not increasing donations from where it started, right? It's not influencing the change in donations, if you will. Next slide. This is just, it's those other kind of, statistical models. And I'm just showing you this to show you that we find the same thing if we do it this other way, that the effect is largely about volunteers, that we do see volunteers, that VISTA presence is affecting volunteers, but not donations. Next slide. So what's the takeaway here? 2 takeaways. Basically, we do find that the presence of VISTA members in a nonprofit is associated with greater volunteering in later years. So we do see evidence of capacity building and that the program is effective at building outreach programs, right, at nonprofits. I do want to point out that going back to that stuff about community outcomes as well, there can be add-on effects here, right? That increasing volunteering and building up volunteering certainly goes beyond the nonprofit itself and could contribute to other features of the community like collective efficacy, right? Finally, I want to say, well, why didn't we see this effect on donations, right? Why didn't we see that VISTA members are kind of increasing donations a couple years later? And here I want to point out that with the data that we had, and I know that there's more and better data being collected, we didn't have a good way to track whether the VISTA members were working on fundraising, right? So we suspect that if we were able to get more detailed information on what the VISTA members were doing, right? Especially if they were working on fundraising or other things that would be directly related to the donation part of capacity building, that we might be in a better position to actually see those effects. Next slide. So I'm ending there to say I'm happy to take your questions and again, I want to thank the Office of Research and Evaluation for providing the funding that allowed us to do this research along with other research.
Well, great, Dr. Paxton. Thank you so much for that presentation of these 2 studies. And I'm going to ask folks, if you do have a question for Dr. Paxton, go ahead and write that out in the chat, and we will call out any questions that come in. I think these are really interesting takeaways, and one thing that I know that you all as sponsors know is we're always asking for information, that whether that's performance measures or through our reports. As I mentioned earlier, our Office of Research and Evaluation has separate research and strategies to conduct research. A lot of those things complement each other. This is, I think, a really exciting bit of scholarly research. I think some of you may also be participating in a project implementation study that we have ongoing. We also have a pilot that we're working on for some food security projects that will employ an evaluation methodology known as ripple effects mapping. So we're excited about seeing what that has to offer. Again, just going back to the notion that both of the information that you provide to us, we make good use of that, for example, in things like our VISTA progress report supplement. And we're taking other efforts to try and evaluate independently and research what the effects of national service are and civic health. And the last thing that I would say before we see if there are questions coming through is that the VISTA program design is an incredibly interesting program, and we have so much diversity among sponsors, among focus areas, among the activities that VISTAs are engaged in, that I think it adds incredible strength to what we can do and what you can do with this resource. It's also an evaluation challenge. And so what Dr. Paxton has done in these cases, I think, is a really great way to tackle that evaluation challenge and see what's happening in terms of our impact. So with that said, let me go to some of the chat questions earlier and call out a few that came in earlier. One question that just came in was where can folks find out more about these research grants? Thank you to Dr. Andrea Robles for including a link in the chat that takes you to our website about our research and evaluation pages and our research grant program. And specifically, you can drill down and see some of the research that Dr. Paxton is referencing here. Let's see, Dr. Paxton, what we've got for you.
There's a question about whether it was the expected result, so I can answer that.
Oh, good. Let's take that one if you would.
Sure. There's a question that says, is this what was the expected result going into the research or surprising? How will this be used? So I can tell you, so the first piece of research we did was the community subjective well-being one. And I'm going to be totally honest here. Like, I was a little surprised that we found an effect because there's a lot that would go into community subjective well-being. So when we saw that, I mean, very surprised and elated, of course. And then we proceeded to kind of hit it with everything we had to like make sure it was really there, which is why we did the reciprocal relationship and we did all the controls and all of the stuff because, to see that with everything else that could be going into a level of influencing levels of community subjective well-being, we wanted to be, very confident that the presence of AmeriCorps in a county was really there, and it wasn't some other explanation. So that's kind of why in the presentation I was going on about all those problems or like what we needed to solve. So yeah, it was a little unexpected to me, but it was really exciting actually, that we can see this effect, despite the fact that there's so many other things that would go into contributing to community subjective well-being. So just really fabulous, and it was really fun to do that. How will it be used? I mean, I think others and AmeriCorps can speak better to that. I know that we are particularly interested in more follow-up research because, especially with the second study, looking at the effect on the nonprofits themselves in terms of their donations and fundraising, because and volunteers, because competition for these resources is great, right, among nonprofits, and knowing that nonprofits have additional resources to help them. And because, of course, nonprofits do important work in communities, et cetera, I think that's very important. And we are very curious to know whether the kind of specific activities that VISTA members are doing in nonprofits results in more donations, more volunteers. I'd be happy to hear suggestions for other outcomes that people are interested in besides those two if we have data on them. So that's how we're planning as researchers to use it.
Thank you,
Dr. Paxton.
Go ahead, Rob.
Go ahead.
Nope.
Sure, I was just going to call out one or two more questions if you think we have time, Desiree.
Yes, we have time.
Oh, great. Dr. Paxton, a couple of more questions coming through here in the chat. We'll see how many we can get to. One of them is, one attendee is wondering, if you could talk a little bit more about choosing Twitter to measure things. They said that, they were surprised by that. And I'm sure with all the things that we talk about with social media these days, can you talk about what the literature is on the connections between community well-being and social media and how you chose Twitter?
Yeah, that's a great question. Yeah. So here's the thing. If you want to understand something about community subjective well-being at a low level, like the county level, or even below the county level, or, we simply do not have surveys that will allow you to kind of go down to that level and make estimates of community subjective well-being. Like, there is just no way to do it with surveys, which is the traditional way that people have tried to measure subjective well-being. So that's what the move to the social media data did for us, was that, I mean, frankly, we couldn't have done the research, right, without having a measure of a kind of a lower aggregated level, like the county level measure of subjective well-being. I mean, there's other possibilities with social media where you could possibly do, not just Twitter or something like that. But for us, that was a way of getting essentially people's own words, right? Their own lived experiences, if you will, as they're tweeting, is giving us this sense of the subjective well-being. Now, I do want to be honest that I think it's getting harder over time. I mean, the time period where we were looking at the tweets was somewhat early days, right? And now I think there are increasing questions about using Twitter and some other social media sites in terms of bots and things like that. And so if we were to try to do another wave of data, for example, or another wave of Twitter, there'd be a lot more we would have to do to make sure that we were actually getting the signal through the noise, if you will.
That's great. Thank you, Dr. Paxton. Another question for you. It looks like one of your research team members have addressed that. Christopher, thanks for chiming in. The question was the data sampled from across the country? Were there any differences observed between types of communities served, rural, suburban, urban, and so on? I think, that's certainly something that we know about our sponsor groups. There's a lot of diversity there in terms of organization types, in terms of location, in terms of focus. Did you take that into account?
Yeah, so the counties we had, we ended up looking at, I think the exact number was 1,347 counties was our sample. I would have to go back and check, but it's something like around 1,300, and they are from all over the country, and they do include a range of counties on a ton of different characteristics. We were wondering about rural and urban, so that is one of the things that we controlled for, the rurality, if you will, of the county. And we did a number of additional analyses, and I'm sorry, it was a little while ago that we did the analyses, and I don't remember if we like split out just the urban counties or something like that. But generally, we did acknowledge that there were, again, all these different ways that counties differ, right? And so that we needed to account for them, like rural versus urban, for example.
Great. I think we'll take two more questions here, and then we'll see if we can move to wrapping things up. If you're still game for a couple more, Dr. Paxton?
Sure, absolutely.
Great. Andy asks, it's interesting that VISTA member presence seemed to have impact on volunteers, but not fundraising at the organization. So switching studies from the study of community subjective well-being to the study on mobilizing resources. Andy says there are more VISTAs with fundraising as part of their assignment. It sounds like he's got some insider info there. Than VISTAs who focus on volunteer programming. Is it possible that the impact VISTAs have on fundraising is somehow not able to be detected by the research methods? And I know that you talked about an interest in segregating out activities as a possible follow-up to this study, but do you have any initial thoughts on Andy's question?
Of VISTA, on volunteer programming, versus, some kind of fundraising. Do I think that there's something that we just don't have the data to really understand the impact of VISTA members on later donations? Absolutely possible, right? So here's one thing to note. On the one hand, right, I said on the VISTA side, we don't necessarily know what they're doing, right? This is just presence or days. We don't know if they were actually doing fundraising or what. On the donation side, we've got total donations, right? So what we don't know, and at this point, I don't know how we would get, unfortunately, but what we don't know is this like a couple big donors? Were they able to actually start a small donor? Like, did they start an annual giving campaign? Like, how, right? And so it's possible, absolutely it's possible that there's effects that we were not able to detect with the data that we had, that it wasn't fine-grained enough in a variety of ways. And that's, what future research will hopefully show more, if we get better data, we can ask more specific questions, and who knows what we'll find.
Thank you so much, Dr. Paxton. And I know there are a few more questions in the chat. So you've got an engaged audience today. We're going to just make a couple of comments and then wrap things up. One thing I just do want to reiterate that as part of this webinar, there is a one-page summary of these two studies that will be available to folks and on our campus. So keep your eyes out for that. I also just want to, again, refer folks to one of the links that was included in the chat for our AmeriCorps Office of Research and Evaluation page. So that includes a lot of the different types of activities, the mission, the objectives, the strategies that our AmeriCorps Office of Research and Evaluation is pursuing, as well as additional information about what studies on national service, on AmeriCorps, on our different programs, on volunteering in general, on civic health. You can find a number of bits of information there, as well as some of what are evidence-based programs and the types of rigorous evaluations, impact evaluations that have been pursued over the last number of years for different specific program models. So I would encourage everyone to check out AmeriCorps.gov. I almost used the wrong website address, or use the link directly in this chat. Follow up and check out some of the information and studies that are stored there. Folks ask how to use this information and where to go next. As Dr. Paxton said, in particular, this second study is in preliminary stages now. It's under peer review, so it's not yet published, but we're anxious to have that process move forward and see what the final findings are. We, from the AmeriCorps VISTA program team, will be thinking about how to incorporate this into our learnings and our program design, into some of our outreach materials where appropriate, and sharing those with you to support a recruitment and making sure that folks know some of the things that are happening, and then looking at what other research activities we might pursue next. So some questions about the connection between organizational mobilization of resources to community subjective well-being, and that connection to poverty. That was one of the questions or comments that came up in the chat. Those are things that we are regularly thinking about, and we'll be thinking about this, this research agenda that we have in front of us in the coming years. So thank you for your questions. I do want to just say that our next sponsor call is Wednesday, January 13th. So please do mark your calendars for that. That will be 3 to 4 p.m. Eastern time. And we've got an evaluation. Speaking of evaluations and collecting data and getting better, we've got an evaluation for this particular call. So please take a few minutes to provide feedback on today's meeting. You've got the SurveyMonkey link there. We really appreciate you joining us. And thank you again, Dr. Paxton, and to your research team. Thank you to our AmeriCorps Office of Research and Evaluation team for making this happen as well. And we wish the rest of you happy holidays here in the next couple of weeks and months.
Sadly, we won't see you till next year. Thank you, everyone.